It's Mari McInerney from Croaky here at Safer Care Vic, a two-day conference in Melbourne, and it's #GiantSteps19. And I have here one of the key figures in this organisation. Could you introduce yourself, please, Euan?
Yeah, morning, Mari. So my name is Euan Wallace. I'm the CEO of Safer Care Victoria.
Thank you very much for fronting up this early in the morning
Oh,
for
thank
us.
you.
Now, can you tell us what actually is Safer Care Victoria?
Yeah, so we're the state's lead quality and safety and healthcare agency. So our job is to work with the Department of Health, Human Services, work with health services themselves, doctors, nurses, consumers, patients and their families to lead improvement in how healthcare is provided.
Now, are you a unique sort of body nationally, or what are you similar to?
Yeah, no, we're not. So, there are equivalents broadly interstate in New South Wales and Queensland, in WA, all slightly different, and most recently South Australia has established a body not dissimilar to us.
And where did Safer Care Victoria emerge from?
So we established in 2017, so almost 3 years old, and we were a specific response, a government response to a report on quality and safety in our public hospitals called the Duckett Report, and one of the 181 recommendations was to establish an agency like ours.
Now that came out of a specific tragic set of circumstances here in Victoria. Can you just explain them, because you were involved in that also as a clinician?
Yeah, so way back now in 2015 it became apparent that there had been a series of perinatal deaths, so stillbirths and neonatal deaths at one of Victorian hospital maternity services, and I was asked to lead a review of that, and we made some findings around clinical governance, around just fundamental safety and quality processes. And the review was about that hospital, but as part of sharing the review findings with government at the time, and Minister Hennessy, now our Attorney General, was the Health Minister at the time, I suggested that actually I think the deficiencies that we found would be present elsewhere. And so the Minister then commissioned Stephen Duckett at the Grattan Institute and colleagues to undertake essentially a similar review but of whole of system, and that is exactly what they found.
And what we're actually going to be hearing from that health service here about rebuilding from failure, I think, is the topic. So that would be very interesting. But what would you say have been the greatest lessons that you've been able to put in action so far?
Look, I think the greatest lessons are actually about valuing and managing the culture of a workforce. And that'll come to as no surprise to those who work in improving organisations, that fundamentally at the root of all healthcare is a consumer, a patient, and a care provider, a doctor, a nurse, a midwife. And I think sometimes we forget to look after the care provider and have a very open culture. There's far too much fear in our organisations, and that leads to people hiding when harm has happened, and if they hide, we can't learn. And so from the very outset, 3 years ago when we opened our doors, we made it very clear that we wanted people to share, and actually we've seen that already. So in the 3 years since our setup, health services are sharing in a way that they never did before.
You're speaking this morning in one of the early addresses. What's your main point there?
Actually, the main point is the workforce. So very purposefully, since we opened, the consumer, the patient, has been first and last in everything we do. At the end of the day, this is all about the patient and her family and her carers. Nothing else matters. But if we're guilty of anything, I think we haven't given due recognition to the fact that in order to do that, to deliver the best health care, we also have to look after those providing that care. So I guess my core message this morning will be, you can't give what you don't have. And at the root of healthcare is just love and humanity. And if we don't look after those who are providing the care, how can we expect them to care?
Now, as people in Melbourne and Victoria would know, there are issues at the moment around safety at the Sunshine Hospital, where there was some clinicians were actually, two I think, were attacked. Is it that safety? Are those the issues? And what else? What are the main issues for staff that you're thinking about?
Well, I think safety in the workplace for care providers, and most recently, as you say, at Western, but not unique to Western by any means, are really important. But that's not the whole story, and actually much more than that. What the industry itself has called burnout among our nurses, among our midwives, around our doctors, particularly our junior doctors. We've got super skilled people, nurses, doctors, midwives, physios, etc., choosing to leave the profession because they cannot cope. This is an industry where people get up in the morning to do good, to look after people, and yet, if we were honest, the system's not looking after them.
And takeaways that you want for people from this conference? What do you want to deliver at the conference for them?
Well, one of the fundamentals of safer care has been a very purposeful, goal-driven, systematic, methodological improvement. And I think one of the core messages I hope will be that the excitement around wanting to improve is one thing. One of the other messages I'll share this morning is actually wanting to improve is not the same as being able to do it. And so if there is broad agreement around whatever it is, if it's about improving care for the care providers, then it's, okay, how do we do this? And how will we measure it? And where do we want to be tomorrow and the next day and next year? And set those very visible goals. And look, if we don't reach the goals, that's okay. We've learned how not to do it, but then we then need to have a replacement method. I think all too often in healthcare we say we want to do something, but actually we don't have the methods to achieve it. And I think one of the strengths and growing strengths of safer care is we bring those methods.
Fantastic, thank you. Now, if it's not rude of me to point out that there is an accent involved in you, and would you like to say that you tweeted some good family news last night?
Oh, I did, Mary, thank you. So our youngest child, Hamish, who's in year 12, just finished year 12, heard yesterday that he's been accepted in the Scottish Conservatoire to do Highland music, so a Bachelor of Music with an intake next year. So super excited.
Fantastic. Did he get that from you?
No, gets it from his mother. So his mother is a musical one. I am completely bereft of any musical talent.
Fantastic. Well, I think there's dancing going on today though, so we'll at least see how you go with that. Thank you very much, Euan.
Thank you.